Good afternoon, Rotarians and guests. It is so good to see all of you. Get it? Nobody laughed at that. That's okay. All right, well, welcome to the Rotary Club of Madison. I'm Teresa Holmes, Club President. Thank you all for being with us today. Today's meeting is being sponsored by Jeff Hughes and Bright Star. Where is he? Oh, there he is. I told him I missed his bow ties. Thank you so much for your support of today's luncheon, Jeff. All right, let's direct your attention to opening music. Bob Dendorf will be leading us in the singing of the National Anthem with Casey Oakers on the keyboard. And as we sing along, let's remember those who are fighting for democracy and freedom in Ukraine. Yes. After our opening song, Rhonda Adams will be introducing our guests.
Thank you, President Teresa. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave? Thank you.
Boy, I'm short. Okay, and I have the distinct pleasure of introducing our guests. But before I do, those badgers last night, right? Wow. What a game, what a season. So when I call your name, if you could please stand and remain standing so we can recognize you as a group. Andrew D. Stadler, guest of Josh Anderson. Chris Camber, guest of the program committee. Samantha Buskey, guest of the program committee, as well as Uma Puta, guest of the program committee. Alan Thompson, guest of the program committee. Michelle Harris, guest of Charles McClymans. Linda Ketchum, guest of Charles McClymans. Kim Kay, guest of Susan Schmitz. Ryan Tews, guest of Jeff Tews. Julie Bennett, guest of Ernie Stettenfield. And Richard McGregory, guest of Carlton Jenkins. Let's give everyone a round of applause. Thank you, guests. And I'm sorry I missed Ed Futa, who is our visiting Rotarian from Honolulu.
Thank you, Rhonda. I heard Ed Futa might be a member of the Rotary Club of Madison. Did I hear that, Ed? You might be a member of the Rotary Club of Madison. I heard that. All right, Rotarians, today we have 3 new members. All right, I will start with Phil Carson. Phil, will you please stand along with your sponsor, Vicki Enright. Phil has been loaned the classification of real estate retired. He is the former general manager for Brookfield Properties Retail in West Dundee, Illinois. Phil is a former Rotarian at Thousand Oaks, California. Originally from Emporia, Kansas, he came to Madison in 2021 with his wife, Vicki, not the Vicki, the sponsor. And they make their home on Twin Fawn Trail. They have 2 adult daughters, and Phil holds a bachelor's degree in education from Colorado State University. He's a member of the International Council of Shopping Centers, where he holds a CSM and CRX certifications. Phil enjoys automobiles, baseball, reading, and volunteering for Music con Brio. Phil, please remain standing, and will Baltazar Dianda Santana and his sponsor, Juan Jose Lopez, please stand. Baltazar was one of our speakers not that long ago. We really enjoyed him as well. Ron Luskin is also Baltazar's sponsor. Baltazar has been loaned the classification of community services and is co-founder and executive director of the Latino Academy of Workforce Development. He was born in Guadalajara, Jalisco, Mexico, and came to Madison in 2008 from Milton, Wisconsin. Baltazar and his husband, Mark, live on South Gammon Road. He holds bachelor's degrees in multimedia and digital arts from UW-Whitewater. Baltazar is also a member of DMI, Downtown Madison, Inc., Destination Madison, and is a supporter of Free Bikes for Kids Madison, Inc. Baltazar enjoys training for Ironman competitions. Please remain standing, Baltazar, and will Kelly Ruppel please stand with your sponsor, Becky Steinhoff. Kelly has been loaned the classification of community services and is executive director of the Ronald McDonald House Charities of Madison. She's a native of Burlington and now lives on West Shore Drive with her husband Chad and their 3 children. Kelly holds a bachelor's degree from the University of California, Santa Barbara, and an MBA degree from the University of Chicago Booth School of Business. She also holds an education business manager certificate from Edgewood College. In Madison, she has served on the boards of Junior Achievement and DMI, Downtown Madison, Inc. She's a proud recipient of the Rotary International Club Scholarship when she graduated from high school. Kelly enjoys running, swimming, and hiking. Rotarians and guests, please join me in welcoming our new members into our club and thanking their sponsors for sharing Rotary with them. All right, today we have our final report about our new committee structure that started last July 1. As a reminder, showing on the screen is our new organizational chart, which you can also find in our members only section of the website. The chart shows that our new structure organizes committees with 5 teams so that like committees within a team are connecting with one another and are more aware of what each committee is doing. Today, we are going to hear about Youth Service Team. Sandy Morales is actually our Youth Service Team leader and was unable to be here today, so filling in for Sandy is Cheryl Whitkey. Oh, there she is. And who is also co-chair of our Scholarship Mentoring Subcommittee. Cheryl is also a board member.
Thank you so much, President Teresa. And, you know, Sandy's awesome, as you all know. I think this has been a terrific experience for all of us to hear what all the different youth serving agencies are engaged in, so there's a lot more synergy around that work. And if I could ask, is Alex here? I'm going to ask the committee members to stand if they are. Janine O'Rourke, is she here? Okay. Laura Pack, I know she's here. Hi, Laura, way to go. Kathy Blumerick, are you here? And Mike Gotzler. Thanks. So these are members of our youth service team, and I want to thank everybody for their involvement in this group. It's been a challenging year given the effects of the pandemic, as you can imagine, and our ability to deliver programming, especially when much of our work depends on work with the schools. In December 2021, area school counselors met with our youth committee chairs as a way to start rebuilding these relationships and get ready for next school year programming. And there's still a lot of activity underway to support our youth. So Rotaract and Interact are led by Alex Vintanier. Rotaract began meeting monthly in person starting in September. Each month features a different speaker as a way to expose students to leaders in the community. And we're hoping Interact can get started up again in the 23-24 school year. Rotary Youth Exchange by Janine O'Rourke. The club is sponsoring La Follette sophomore Riley Dirk for the 2023 academic year to study and live in Chile. We will not be hosting an exchange student in the 2022 academic year, but we'll take the year to strengthen our program by promoting youth exchange with area high schools and making it more accessible and inclusive to all students. Promoting youth exchange with our club with the goal of building our host family list. And again, we encourage everybody to think about how delightful it would be to have a student from another country stay and be supported by you and our club. The Scholarship Committee led by Laura Peck. Once again this year we're offering Rotary scholarships to 25 outstanding high school students. The Scholar Mentor Committee, led by myself and the good guy Rob Vandenberg, are actively recruiting scholars to serve as mentors, or Rotarians to serve as mentors. So please consider being a mentor. We need you, and it's a great experience. We get more out of it as mentors than I think we provide to our scholars. Youth Awards, led by Kathy Blumreich. The committee is on track for planning their annual Youth Awards program, set for April 27th. And the Ethics Symposium, led by the amazing Mike Gotzler, who keeps plugging away in spite of, the challenges with that project. After 2 years of not having an ethics symposium, we have fingers crossed that we're going to move forward on it in 2023. So thanks to all of the members of this committee and to Sandy for being our fearless leader.
Thank you, Cheryl. All right, so for my Did You Know segment today, I would like to focus your attention on the annual event that brings Rotarians together beyond our local Rotary Club. So this year, that event is the Rotary Tri-Con event that will be held in Elkhart Lake on April 29th and 30th. This year's conference is actually comprised of 3 districts. District 6220, our district 6250, and District 6270, which actually covers, this conference of 3 districts will actually cover almost the entire state of Wisconsin, except a small portion of the upper northwest section of the state. So it will be exciting. And Rotarians, I don't know if he's in the room, but such as Jason Barron and our own Scott Strong will be presenting this year. As well, I'm not sure if you're aware of this, but many of you may not be aware that Karen Kendrick Hands, who actually leads our ESRAG Rotary Action Group, will also be speaking at one of the breakfast sessions. And so we have a 1-minute video, I believe, Jane, that we'd like to show you.
Hello, Rotarians. I'm Governor Sridhar from Rotary District 6220. Are you ready to have lots of fun meeting hundreds of Rotarians from across Wisconsin, Upper Peninsula Michigan, and parts of Minnesota? Are you ready for some exciting collaborations to bring about meaningful change in your own communities and across the globe? Then we have the right opportunity for you. Please join us at TriCon 2022 to be held on April 29th and 30th at Osthoff Resort in Elkhart Lake, Wisconsin. Go to RotaryTriCon.com and register today. We would love to see you.
You can also register, as he said, at RotaryTriCon.com, or you can contact the Rotary office for arrangements and information on carpooling. I have birthdays to celebrate with a bit of humor or wisdom that complements our Rotary mission. We also encourage our members to make an age-appropriate gift to the Madison Rotary Foundation, rounded up to $100 for our club's Synergy Scholarship Fund. Rotarians, if you are in the room when I call your name, please stand. February 27th, Debbie Biddle. February 29th, Sandy Geller. We should ask her, when did she celebrate this year? March 1st, Eli Van Camp. March 5th, Paul Kark. Thank you to our celebrants and contributions to the Madison Rotary Foundation. Rotarians, please join me in wishing them a happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Rotarians. Happy birthday to you. We do have a few members in the news, but first I'd like to mention, for those of you who are not aware, our own Ann Lucky's father passed away, Paul Lucky, on February 19th in Milwaukee. We extend our condolences to Ann and to her family. Members in the news, Moses Autic was interviewed in a Wisconsin channel, or WIC3 channel, 3-story entitled, Invasion of Ukraine Will Likely Send Gas Prices Over $4 a Gallon in Wisconsin, UW professor says, February 24th. Colleen Kerr was pictured and quoted in an article titled, A Win with UW System Pack for One City Schools, Wisconsin State Journal, February 24th. Tara Grays, Joe Loanis, Winsey Melendez, and Cassidy Wardenweiler are among those who are listed in this year's In Business 40 Under 40 class, February 24th. And Marcy Henderson was featured in a WISC Channel 3 story titled, Where Are the Cookies? Those of you celebrating Ash Wednesday, you don't want to know, right? But Girl Scouts Talk Supply Chain Plan to Avoid Delays, February 22nd. Thank you, Rotarians, for making news. Is there a birthday, an additional birthday? More Rotary news? I see an on the floor, off the cuff. Huh? Oh, we have hecklers. New members, we also have Rotary hecklers. Just so you know. If you love to laugh, just join in. All right, now on to today's program, right? Today's speaker is Areli Estrada, who joined our Rotary Club a few weeks ago. They laugh because the president often butchers the names of the speakers and is fined. Areli is Executive Director of Affordable Dental Care, which is a nonprofit dental clinic which serves the uninsured at-risk population. She holds a bachelor's degree in applied studies with an emphasis in human development from UW Green Bay, and she earned a master's degree with a specialization in community development from UW-Madison just this year. Today, she is going to tell us about the importance of dental health. We look forward to your presentation, Areli, and we have made a contribution to the Rotary International Polio Plus Fund as a way to say thank you for speaking to us today. I'd like to mention that if you have questions at the end, our speaker will have a Q&A time if allowed, and please wait for the microphone if you do have a question. Rotarians and guests, let's please welcome Areli Estrada to our podium.
Hi, hello everybody. Hola todos. I got her inside joke. She called me Arela when she initially introduced me to Rotary, but you got it right this time. Well, I am so excited to be here. But first, I actually have a trivia question for all of you. If you are a dentist in-house, one of my guests is our volunteer dentist. He is not allowed to answer this question. So my question to you, and you can raise your hand, how often should you change your toothbrush? Raise your hand if you think it's monthly. Oh, someone raised their hand back there. Okay, that's fair. Twice a year, raise your hand if you think it's twice a year. Great. Every 3 months, or once a year. Love it. I love the combination. The correct answer, what do you guys think? What's the correct answer? Every month. Yes, every 3 months. That is correct. I need to find the clicker. All right. So I'd like to move on and just, first and foremost, I would like to start off by expressing gratitude. That is very, very important to me. I am here today because of so many of you. Like Anthony Gray made this happen. It actually, last fall, maybe over 5 to 6 months ago, he came to our clinic and we were just chatting, and I told him, hey, I would love to have the opportunity to present about the critical work that we're doing in our community regarding access to dental care. So he picked up the phone, he called Regina, which I have yet to meet her. But thank you so much, Anthony Gray. And then Juan Jose Lopez, I guess I don't think I could talk to him enough every day. He has just been so supportive of guiding me and just connecting me to many of you. He was the one that brought me to Rotary for the first time. So thank you, Juan Jose. Oscar Mireles, he introduced me to Ron Luskin. Shout out to Ron Luskin. He did email me. He's in Hermosa Beach. I grew up in California and LA, so I'm very familiar. And Neil, I have a video to present to you guys, so you're going to be seeing that. And of course, I cannot forget my clinical team. They're working really hard right now. They're seeing patients. And then, there's some support staff here, like our office manager, Alan Thompson, and he makes sure that everything runs smoothly with the scheduling. I have our fantastic volunteer dentist, Chris Kammer, and we look forward to some questions towards the end. So maybe he might be assisting with answering some of those questions if you guys have any. And then I have an AmeriCorps Vista who helps me. She keeps me on my toes and reminds me that, hey, you forgot to do this. And then I also have an international volunteer dentist here in-house, Dr. Uma Putash. She's from India, and she's been so instrumental with doing a lot of outreach educational work in the community. So thank you all so very much. If I didn't mention your name, please forgive me, but I truly appreciate your support. And Marcio, we went to your school last week, I think, at Lighthouse Christian School. We completed Kids National Oral Health Month. We showed up with firefighters, and kids were really excited. So we really try to create more awareness. And I just appreciate the support from our community leaders. So thank you all so much. So without further ado, I'm going to start off and I want to share a little bit about the process. I seriously felt that I was preparing for my master's capstone project all over again when I was trying to compile this presentation. So I conducted informational interviews with local clinical people. So I'm just explaining a little bit more about the process. People with Health Watch Wisconsin, our clinic participates in these meetings. I talked to folks family liaisons, the family health liaisons at the Madison School District. So I conducted a lot of informational interviews, and outside of that, I also did, I used sources from the American Dental Association, Delta Dental, CDC, the Department of Health. So anyway, so you'll be seeing all of that, but I just wanted to share more of that process. So a brief history about affordable dental care. So affordable dental care was founded in 2009 by Tim Buck, and that is the founder there, that's him. He lives in Menasha. So the clinic was founded in Norman and Whitewater. Initially, they started off by seeing just a few dozen patients, and over the last 3 years, it has grown to over 6,000. And in 2018, they moved to Madison. And we moved to Madison because there was a higher need and demand to see more people here in this area. Currently, our clinic, we're located on the northeast side of Madison. And we actually, our site, we sit in a health shortage area. Are you guys familiar with what that is? What is it, Neil? Yeah, so it's a desert of healthcare providers. There's a lot of disparities. We do not own our building, but I'm not here to talk about that. You can ask me more questions. But our mission is to close the gap in the crisis of access to dental care by restoring hope, health, and opportunity to the uninsured and at risk. And we do this in a nonprofit partner power model that treats any individual who has put off dental care due to financial, physical, or educational hardship. We do not check for anything. No documents, no income. We don't do sliding scale. It's low fees. We don't really care about none of that. We really just want to serve the people. And I strongly believe, as the executive director, that nobody should not have access to dental care due to cost. And we have a really amazing Agape Grant program, too, for people that struggle financially. They can tap into this funding, and then we interview them, and then we're able to cover 30 to 50% of their dental cost if they cannot afford it. Just a general overview. Like I said, we do not accept insurance and do not compete with private practice dentistry or government community health care. Rather, we exist to fill the gap of patients who fall into neither category. In light of longstanding data, which shows that oral health has a large impact on general medical and psychological health, we provide quality full general dentistry without the traditional fees. Our costs are typically 50% or more less compared to what someone is looking at paying at a private practice. And then, so what do I have? So some of the, according to the CDC, so these are some oral health facts. So oral health is essential to the general health and well-being of individuals. Oral disease can cause pain and infections that may lead to problems with eating, speaking, and learning. And we see a lot of our patients that come in with those type of problems. In the video, you're gonna see someone like, they talk to us, I have to cut my food into little tiny pieces, and that's the only way that I can eat. So the 3 oral conditions that most affect overall health and quality of life are cavities, severe gum disease, and severe tooth loss. More than half of the population we see, that's 80%. And in 2021, we saw 2,700 patients. They suffer from gum disease, and it's very severe. By age 8, over half of children have had a cavity in the primary baby teeth. My son is 3 and he has no cavity, so yay to me. And then children from low-income families are twice as likely to have cavities as children from higher income compared to higher income families. 1 in 4 adults aged 20 to 64 currently has cavities. I actually know someone in his mid-40s. He has 4 cavities, so he's going to be coming to seeing us. And then there's just other statistics. So on average, 34 million school hours are lost each year because of unplanned emergency dental care. And over 45 billion in the U.S. It's lost in productivity. And all of this is due to untreated dental disease. All right, and I have this visual. According to the CDC, this is from the CDC, half of American adults suffer from gum disease. So gum disease, I was asking Alan earlier today, I'm like, how do you pronounce this? It's such a fancy word for me, because I'm not a dentist, but it's called periodontal. What is it, Alan? Periodontal. So periodontal disease has been linked to other overall health issues like diabetes, heart disease, osteoporosis, respiratory complications, and cancer. So essentially, that's really like why I'm presenting here. It's just really to highlight the correlation between oral health and systemic health. They're linked. So if you are diabetic, you are more susceptible to periodontal disease. In others, like with heart disease, the inflammation in your mouth is considered a potential cause of inflammation elsewhere. This inflammation elevates the risk of a blockage-related emergency, such as a heart attack or stroke, by 2 to 3 times. And here's more statistics. So when I was compiling my research and looking for data, I looked at what the national statistics are, and these are some of the national ones. And I also looked at the statewide, Wisconsin, and locally as well. So this is the national one. So more than 56.7 million people in the U.S. live in areas with dentist shortages, and that's very true to where our current clinic sits right now. Access to care is also limited for the 72 million children and adults who relied on Medicaid and the Children's Health Program. Only about 1/3 of U.S. dentists accept public insurance, and that is very factual, and it exists within Dane County. Many private practices do not take Badger Care or Medicaid, and do you guys know why? I'm just so fascinated that I've been learning so much information in the last so many months. But do you guys know why private dentists don't take public insurance? Sorry? Yes. Yes, absolutely. Yeah, so low reimbursement rates. But this year, I think they have increased it to 40%, if I'm not mistaken. So then there's also a ton of disparities, and it is, like COVID happened, but prior to COVID, disparities have always existed, especially in communities of color. But when COVID happened, disparities became more evident. So these are more like disparities in oral health. So some social, racial, ethnic, and socioeconomic groups have worse oral health, and this is as a result of the social determinants of health. So this is based on where people are born and live. And so many of the people that live in these, based on the social determinants, they cannot afford to pay out of pocket for dental care, do not have private or public dental insurance, or cannot get time off from work to get to dental care. They live in communities where they don't have access to fluoridated water and school sealing programs. Madison is doing a great job with the sealing program, but I'll tell you more about it. I have another slide for that. And public transportation. They don't have public transportation to get to their dental appointments. Those are the type of patients that we see too. And it's just really like, I relate to so many of the patients that come and see us because I experienced poverty at an early, young age. Up until the age of 7, I grew up in a very impoverished, underdeveloped village. There was no running water or electricity. And then I forgot to say that I don't think I've ever felt so privileged to be here. I have never felt this privilege because it just means a lot to me to be able to be in front of so many of you. And create more awareness, and because I think of my background and my upbringing. But anyways, patients do share, I don't have a car, I miss the bus, or, I work at McDonald's and I'm afraid to drive. I don't have a driver's license, so I have a ride or a taxi drop me off. So we do tend to see a lot of this, so this is very factual. So many low-income adults do not have public dental insurance. All right. I think the video's coming up pretty soon. Okay. So what happens if we ignore dental health? So if left untreated, Obviously, we're going to experience pain and tooth loss. Unfortunately, some of the patients that we see, they go decades without seeing a dentist. Some of the common barriers is cost, education, and what is the other one, Alan? Transportation and fear. Yes, there is I think 70% of people have fear of seeing a dentist. But yeah, so what's that? And anxiety. Yes, we see so many patients with anxiety. We have a really cute water fountain, where it really suits our patients. And that was through a grant that we received. But yes, a lot of anxiety. Patients, sometimes they experience so much anxiety that they get up and they walk out of the dental chair. We have seen it. It happens. If we don't treat our oral health, then it also impairs children's growth and social development. It hinders productivity in the workplace or job opportunities. Many of the patients that if they don't get treated to their oral health, it affects their overall confidence, and then therefore they don't do well in interviews. They exacerbate chronic conditions and complicate detection of oral cancers. It makes it very complicated. And that's just a little blurb. I think I already shared more about that. And then oral health of Wisconsinites. So what's happening in Wisconsin? A lot of great things are happening. I never thought that I would be in Wisconsin this long. I'm from California, but I consider myself a Wisconsinite at heart. My friends make fun of me when I go back to LA, and they tell me, you talk like a Wisconsinite. They cannot even pronounce Wisconsin. They say Wisconsin. Okay, so oral health of Wisconsinites, and this is based on studies from the Department of Health and the ADA and Delta Dental. So, there's a large factor of inability to afford the cost. Inadequate insurance coverage, that's very existent and real as it gets in Wisconsin. Preventative dental services is not covered through Medicaid insurance. 1 in 5 children go without dental care. And almost 1/3 of Wisconsinites do not regularly visit a dentist. But we're trying to change that, and we will. Yes. So I have a little video for you guys, and it's more about the clinic.
Dental care is expensive, and having the work that I'm having done is quite expensive, and affordable dental care has made it a lot easier and provided me with resources.
My friend came over here, and she made an appointment. She said, Sharon, this is the best place I've ever been. She said they're very patient, they're very kind. She said there's scriptures on the wall, which was huge for her and for me.
Para mí ha sido bastante difícil acceder al servicio dental porque debido a que tuve un accidente, mis gastos médicos se elevaron por las nubes y me quedé sin poder trabajar.
My name is Areli Estrada. I'm the Executive Director at Affordable Dental Care. We are a nonprofit dental clinic located on the northeast side of Madison. The population we serve is very complex and diverse. People that have retired and lost access to dental care, some veterans. This past year we served 46 veterans. Almost half of the population we serve live below the federal poverty guidelines.
So I was so excited when I learned about ADC. It was a chance to serve a population that is often, I think, unseen in terms of being able to serve them, getting them access to care. It's also a chance to work in a place that was founded on Christian values, which is really important to me. My name is Kepler. I'm the dentist here at Affordable Dental Care.
When I came to Affordable Dental Care, they gave me confidence that I would be able to smile again, that I would be able to get through life, be able to eat. There's some foods that I can't eat. There's just no way. I'd have to cut it up in little teeny pieces to eat it.
I saw a patient today who came in with pain and we ended up extracting a tooth. But that day he said to me, I need a new smile. I really want my smile back.
My name is Victoria and I am the dental hygienist for Affordable Dental Care. My job as a hygienist is to treat their underlying disease and maintain it through multiple appointments and give them quality dental care that they might not receive elsewhere through excess. Oral health is directly linked to systemic health. Periodontal disease contributes to many systemic problems, including heart disease, diabetes, stroke. New data is showing signs of it being linked to Alzheimer's, cancer, inflammatory diseases, and more.
While we are a bilingual clinic in English and Spanish, and it is, I get to have fun too. I get to speak in Espanol and translate for many of our Spanish-speaking patients.
Los precios para que te atiendan son accesibles. Tenía muchísimo dolor en esta parte de la cara. No tengo auto, yo me movilizo en bus.
My name is Alan Thompson. I'm the office manager at Affordable Dental Care. The people we serve are the people that either can't afford that dental care or even people that are just putting things off due to cost. Sometimes people delay things out and that can have bad effects on their teeth and their health.
The procedures we offer are comprehensive, so we can do emergency exams to treat patients in pain. We also do comprehensive exams, cleanings, fillings, extractions, crowns and bridges, dentures.
Unfortunately, it takes nearly 4 months for a new patient to be seen. There is definitely a high demand of our services.
Currently, we're using really only about 3 operatories, and our clinic has 4 available. We hope to get the 4th one up and running soon. But in an ideal scenario, we would like to have 7 to 9 operatories, and we could really just help see more patients in that.
Everyone's very nice, and they make you feel very comfortable. And it's hard going to the dentist, especially when you're having work like I'm having done.
It sounds kind of stupid, but I felt like I was a revered grandmother. Someone that they loved.
Affordable Dental has amazing people. They're all angels, and God bless them.
So that was O'Neill. That was his work. He helped me with developing and producing the video, and I was his assistant for the last 5 months. So thank you, Neil. So I'm just going to highlight some of the demographics, and then I will move on and just discuss more of the linked and correlation of oral health to systemic health. But our demographics, that's just a list of, the percentage in females that we see, the males, preferred language is English, 80%, and preferred language is Spanish, 17% they speak Spanish. But then in comparison to Dane County, because the majority of people are Caucasian, so relatively we can say that is a high percentage of people that are only Spanish speakers. Some patients, they bring their own interpreter if they speak another language like Hmong or any other language that we're not able to translate, but we're very welcoming in that regard. Like I mentioned earlier, more than 80% of our patients suffer from gum disease, and it's very severe. In 2021, it was our biggest year yet, because the best is yet to come, I believe. But we had over 2,700 patient visits, and 1,300 of them were unique visits. Many of the patients are ineligible, unfortunately, for any type of insurance or any government aid assistance programs. Clearly dental health is separated from overall health, and that is an issue. Like the benefits, the general insurance benefits that someone gets does not come with vision or dental. Don't ask me why. That's just the way that it's set up. But dental health should no longer be viewed as separate from overall health. And I think we have a lot of work to do in that regard. Studies show a very strong correlation between periodontal diseases and several of the leading causes of death, including heart disease, cancer, lung diseases, diabetes, and stroke. So what problems could poor dental care cause? So that's a visual representation, and it's some of the diseases that I already mentioned. One of them is strokes, heart disease, mouth cancer, lung conditions, respiratory, so there's a ton. But you may ask, like, how? Like, and this is just so fascinating. Like, I've learned this. Like, so how can oral health affect overall health? So in one word is bacteria. That's all it is. So that visual, bacteria, like in the mouth, enters like your bloodstream, and then it just kind of starts running through, and then it slowly starts building some clots. So the processes in the mouth contribute to vascular diseases. So I think that was a really cool representation to explain that. So the link between gum disease and heart disease, like I said, research indicates gum disease may increase the risk of heart disease and stroke. So people with gum disease are twice as likely to have heart disease, and similar to people with strokes. So what is happening in Wisconsin? So from what I gather, and I have a partnership with the Wisconsin Association of Free and Charitable Clinics. So they do a lot of advocacy for free and charitable clinics. So during one of the informational interviews that I conducted, I was told that there are 90 free and charitable clinics throughout the state. However, only 25 of them are dental. So there is the Celebrate a Smile program. Thank you, Dr. Jenkins. He supports that program, but however, it's great. And access, but there's only like so many access. I think there's 4 healthcare centers or community healthcare centers. They're the only ones that oversee this program, and they come and treat. Pre-COVID, they used to come and do sealant, so treat cavities for children. But after COVID, and this is from another informational interview from a family health liaison at the school district. What they're doing now, they're just doing the varnish. So just adding vitamins to the teeth. So it's unfortunate, that we're still kind of trying to navigate through those protocols, but it's so critical to bring in the Celebrate a Smile program to the schools. And I think we need to go beyond middle school. In 2022, this year, which is really exciting for the school district, they started taking referrals for high school students. So currently, high school students are not being seen. However, high schools are taking referrals and they're being sent to Access. Although, unfortunately, it takes nearly 6 months to get into Access. And that's the wait list. So in conclusion, we need to, I believe it's very critical to increase the number of available providers through the additional of mid-level practitioner called dental therapist. And if you guys have questions about that, we'll gladly answer them after. We need to expand school-based sealant programs. I would love for affordable dental care to participate in that type of programming. I want the whole state of Wisconsin to know about affordable dental care, and I think it's just so critical, and we need to come together and collaborate. And the only way that we'll be able to make a difference is by working collectively. So I truly appreciate the support of people that are able to make those type of decisions. But we need to support community health dental clinics. Our clinic, in fact, it is a community health clinic, but for some reason, it hasn't really been set up officially, but I am so excited to announce that is soon to happen. So I'm already doing all the documentation, so that's pretty exciting, and I think that could be a reason why we're not able to do the Celebrate a Smile program. I think the system, they need to increase Medicaid reimbursement fees for other dentists. And last but not least, good oral health is critical to our overall health. Thank you all so much for listening, and I'm glad to answer some questions.
Okay, our mic duty. Oh, we have mic duties. So I have a question. Yes. It's actually related to the increase the Medicaid reimbursement fees for other dentists. So I heard you say earlier, Badger Care only pays 40% of the amount for reimbursement for the dental care. Is that correct?
Yes.
Is that what I heard you say? 40%?
They increased their payments to dentists by 30 to 40%.
To
now,
dentists.
at that increased level, it's still 1/3 of what you would pay a traditional dentist in time. So the reimbursement rate is 66% less for the Badger Care.
Yeah, so my question was going to be what you referred to as what has to happen in order to get that to increase? Because I would think that if you cover more, then they'd have more people who would want dentist offices, who would want to take those patients. We'd have people who could get basic dentistry. Yeah, so.
I think it's part of the system, and it goes back to funding and the disbursement of those funds. But Dr. Chris Kamler is helping me answer questions as he is an expert and he is the dentist.
I just wanted to tell you, you'd be interested to know that a number of years ago, when there were no dentists to service lower income people, this club paid 3 years for the first dentist to go to the community access clinic. Mm-hmm. And so we've had a long commitment in appreciation of the need.
I would love to be able to do that type of mobile. We're interested in even doing a mission trip. The sky is the limit, but thank you. Thank you so much for sharing, Melanie.
Okay, I have a couple questions. I was involved. What?
One question.
Oh, I only get one question. Well, but at any rate, I was involved with the National Guard. We sent contingencies to Central America, and I realize that you emphasize on Wisconsin. But one thing we learned from that is we'd hand out free toothbrushes, but that was not very, not useful at all, because they'd use it once and throw it out or not know how to use it.
Correct.
So the question really has to do, what do you do with teaching patients how to take care of their mouths better so that they aren't getting bad dental problems that have to see you?
Yes. Yeah, so we are not a free service. Our fees are reduced because when we invest in ourselves and our health, I think we take it more seriously, so it's a way of holding our patients accountable. But a lot of what we do is preventative and restorative, and it's educational. So we do educate our patients about how to floss properly, how to brush properly. Our hygienist does a phenomenal job with that. We get, the majority of our patients, we get them on water flossers, a water pick. So yes, we do a lot of educational, and then one of our efforts, we also go into the schools, and then we get to do skits with the children, and then we really teach them and educate them. And it's not just a free toothbrush. We don't want to just give a free toothbrush. We really want to educate.
Do you offer emergency dental care? Are you on the bus line? And do you have extended hours?
Our hours are Monday through Thursday from 8 to 5. We are on a bus line. We are at 2110 Fordham Avenue. And emergency cases, yes. Typically it takes about 2 weeks. So Alan does a phenomenal job, our office manager, to allocate and just fit people in. But emergency cases, yes. I think we had about 700 emergency cases last year.
Thank you for being willing to address your fellow Rotarians, because by now you know this is a very tough crowd. I'd like to know more about your funding.
Thank you so much. You got me really sad now. We're a nonprofit, so I have no administrative support, and I'm the person that gets to write these grants. Last night I submitted a grant at 11:30, but it's grants, our revenue it's a service for fee, so that covers some of the expenses, but I really need more support in terms of sustaining the financial state of our clinic. We need to expand. We have 4 operatories, but to answer your question fully, it's individual contributions, donations, grants. We have a large fundraiser event, the Smile-a-thon. So all of you are more than welcome to come in and run the Smile-a-thon in November. Please reach out to me. I would love for all of you to show up and run and help me raise funds to continue to keep the lights on at our clinic.
Thank you, Areli. Thank you. Rotarians, we are adjourned.